Hello, my name is Miles Sully, and I'm a student physical therapist. From the first part of the interview, I heard you state that your mother's having left knee pain. You described it as an achy pain, and usually you would use Tylenol to make it feel better. If not, it would be something stronger for pain. Also, she has other medications that manage her other past health occurrences like high blood pressure, diabetes, anxiety, previous heart surgery, things of that sort. Next, you stated that she's not very active, so she sits or lays down most of the day. She is able to walk independently when there is no pain, but when there is pain, she requires some assistance from you or a caretaker that is present. And lastly, I just wanted to restate the goal that you provided for me for her. And it states that you want to reduce her pain to a reasonable level and make her muscles stronger so that she is able to move more effectively. Next, after that, I did some tests in the exam, and what I found was that she is able to recognize her name and where she is. So for dementia, it's good to know what they are able to do and what areas they might struggle in and need some improvement. So she is able to recognize her name and where she is. Um, Movement wise, she is limited in some motions. So in her left in her left leg, she's limited at the hip, and on the right, she's having trouble with moving at her hip, knee, and ankle a little bit. Next, I did see that her strength is pretty good for her ability to walk, to go from sitting to standing, and to move in and out of bed. Um, Now, granted, that's with uh, probably a low level of pain. When pain does come, it definitely becomes more difficult for her, and that's where she will require assistance. And the last thing in my exam that I saw was that she might need a little bit more assistance in walking within the house, and she also has a shuffle with her feet. So she might not be picking up her feet as much. She might just slide them across the floor. And also at the waist, she leans forward, and this goes all the way up from her waist to her head. So her head is leaning forward as well. And this could cause a concern for balance, um, as well as seeing where she is going and her surroundings. So, next, I think the main problems that I can help you with is improving your mother's muscle strength and her ability to move in general. And the reason why I want to focus on those is because without that, she would be limited in certain tasks within the house, like going up and down the stairs. I know there's a machine that you use for her, but improving her muscle strength and ability to move might give her the opportunity to move up and down the stairs, as well as improve her posture. That forward lean at the waist might be making it difficult for some muscles to work. So if we improve that, it might allow some of her muscles on her front, or in front of on the front of her, I should say, to work better, and it could potentially decrease her pain overall. And then next, I think this could impact the both of you and other family members by making her more active. Uh, by making her more active, she will enjoy exercise. For instance, as stated, that she might even enjoy going for a walk with you outside occasionally. Just a different outlook on life, and brings more quality to her life that she is living. Next, as I previously stated, I think your mom would benefit from therapy because she does have the desire to be mobile. As we have seen, she is able to move, walk, able to go from sitting to standing by herself when no pain is available. So I want to work to a point where that becomes more, it happens more, I should say. Um, and with that, I feel she'll find more enjoyment in exercising and being more active, and overall, she will enjoy life more. So, a few things to expect as we begin these sessions. The pain itself might not be gone immediately. As like session two, it might not be gone. This could take a few sessions for her body to get used to. But once we continuously keep working and improving in muscle strength and her ability to move, I feel that the pain will reduce in not a long time, probably a few sessions or so. You'll see improvements in reduction of pain, and just continue from there. Also, I think that as we progress, we should reassess and see where your mother is at. So if what I have planned is not correct and is not improving your pain, then we will reassess and make adjustments as needed. So a few things that you and your mother can get started on as the patient. We will focus a lot on stretching the front part of her body. So especially at her hips for both sides, we want to be able to stretch that out. And this will be able to, this will help improve her posture. So she will be standing more upright instead of the leaning forward at the waist. Also, the other areas that are limited in motion on her left side, her knee. So just be able, stretching so she will be able to either straighten out her knee more or be able to bend her knee a little bit more, and then her ankle as well. Just movement will help. Motion is lotion, so we will continue to look at that. And then also staying more active around the house. Just encouragement of telling her, hey, let's get up, let's walk around, let's do some chores that might require some walking, some lifting, things of that sort. Just so she's getting more accustomed to moving around a little bit more, and that's the main goal that you as the patient and the patient's caretaker can start on right now. Another service that might be helpful is a psychologist, and the reason why I suggest this is because it might just be another person that can relate to her, that she can talk to about her anxiety that she's feeling, as well as any other difficulties that she has with her dementia. She just feels like talking in general to somebody new. A psychologist might be helpful in, helping with her thought processes, and is that a word? Helping with her thoughts, and just be able to use her words when she can. And lastly, I just want to give you a brief overview of what I plan to do. So I would like to start at two sessions a week for 6 weeks. And from there, we can reassess, as I stated before, and make adjustments where needed. And the type of exercises I'll be using will include chores. Now, I say chores as in things around the house that will require her to be able to walk, be able to pick up items. These tasks won't be extremely difficult, but for her, it would be good to get her up and moving. Also, I'll do some strengthening exercises, especially in the legs, as she is in a sitting position or lying down in bed. And potentially these could be exercises that she can do, or both of you could do on your own outside of session time. And then I will want to focus on some stretching to help her body become more mobile over time. And this will help with her muscles working better, her posture. Potentially, it could help with her breathing. She might begin to breathe a little better and not really have difficulty breathing, things of that sort. So, there's a lot of benefits that come with it. And yes, that is my plan. So, thank you again for letting me watch the video. And yeah, this is my assessment of plan.